being bombarded with health apps and gadgets claiming to detect all sorts of life-threatening diseases. Now, one study claims the pulse from your fingertip can detect whether or not you have heart disease. But are these gadgets and apps really worth it, and how do you know? Joining me now, Dr. Stephen Reisman, Director at the New York Cardiac Diagnostic Center. It's great to see you, Dr. Steve. Thanks for coming back on the show.
Thank you.
So how does the pulse in your fingertip tell whether you have heart disease or not?
Well, there are several devices that use the pulse in the fingertip. We happen to use a particular device called EndoPad. And what that does is it measures, after you're compressing the brachial artery, the elasticity of the arteries. We know that arteries that don't dilate properly have greater tendency to build up fat.
Wait. You're really technical for me. So now what does it do? It's measuring your heartbeat? It's measuring
blood flow.
Blood flow.
The technique that we use is measuring blood flow. You compress the artery above for 5 minutes. You release it. You have a probe in one finger in that hand and a probe in the other finger in the other hand, which is the control. And then you measure to see what happens after you release the compression. Normal arteries will dilate properly or will increase the blood flow quite a bit. Arteries that already have a dysfunction called endothelial dysfunction will not improve to the same degree.
So you can tell like that whether somebody has some kind of heart disease, and it's really looking at how well your arteries work, right?
Exactly. It's a very early predictor to see who's at risk later on to develop problems in their arteries, and it can be used in younger people in their 20s, 30s, and 40s.
I think it sounds great. Are there any downsides to this?
It's a totally non-invasive test, no radiation. It takes 15 minutes. Insurance usually covers it. It's a very simple test.
Should I do it myself? Should I buy one of these, the Pulse Sensor Amped or the Quest 3-in-1 Pulse? Should I buy one of these myself?
Well, those are different. Those tests are different, measuring, your oxygen in your blood. This is actually measuring how the blood vessels dilate or not, when you give a compression. These are done in the doctor's office. They don't need to be done on a regular basis. So you do it once a year, once every 2 years, something like that.
Now, you said anybody can do it at any age, but does it work better on some patients than others?
No, because it works pretty well on everybody, because there's no real restriction, whether you're thin, whether you're heavy. You just have to get a blood pressure cuff around the arm, put the probes in the fingers. The only restriction is women who have long nails have to cut their nails on that finger before the test.
But that's it?
That's pretty much it. You shouldn't take caffeine or medications in the morning. And it's nothing, we do that in the doctor's office. We've been using it for about 8 months, and we feel it's very effective in the early prediction of risk for heart disease and risk factors of heart disease.
So I can't have coffee that morning. That's a big negative for this.
You got to cut your nails.
So do you have any concerns about all these gadgets coming out? Because many of them are for people to use on their own without the advice of a doctor. What should I watch out for?
Well, I think there are some good gadgets out there that are like smartphone apps that can deal with your blood pressure, tracking your blood pressure, keeping a record of it. Certain of them work in diabetics. Certain of these apps that you can measure your glucose and track that. So some of them are very useful for a day-to-day basis for many individuals. Some of them are less useful, and I think they really don't need to be in the patient's hands, and it's really more for a doctor's office.
High blood pressure is probably the most common problem in the population right now. What kind of advice do you give to people to prevent heart disease? What are the early indicators you have a problem, and what can you do about it?
Well, the only way to check if you have hypertension is to go to the doctor and get your blood pressure checked. And if it's abnormal, you need to check it several times to make sure that you don't have hypertension. It's a big risk factor for heart attack and for stroke. How do you try to treat it or prevent it? Low salt in the diet. Make sure you're good weight. Your weight is you're not too heavy. You exercise at least 30 minutes a day of a moderate walking pace. Do things that really can keep you in good shape.
All right, so salt's the most important of those?
Salt's very important. Weight. And those are the things, and sometimes it's a genetic issue, and there are other hormonal things that can really cause the high blood pressure. We do testing for that just to make sure.
All right. Well, Doctor, thanks for coming on today. Great information, interesting stuff, and I love all these new gadgets. They're just terrific.
They're unbelievable.
Yeah. Thank you so much.
Pleasure.